Hi everyone, it's Dr. A, and in this video, we're going to investigate the action, origin, insertion, and innervation for muscles of the upper extremity. The first group of muscles that we're going to investigate are the rotator cuff muscles. And as you'll notice, the arrangement of the muscles listed on your screen, we have an acronym that helps us to commit the names of these muscles to memory. And that acronym is SITS. And if you can remember SITS, you can remember each of these muscles. The first, S, represents the supraspinatus muscle, and from there, the I stands for the infraspinatus, the T is for the Teres Minor, and the last S is for the Subscapularis muscle. So the first muscle of the rotator cuff that we'll investigate is the supraspinatus. The action of the muscle is abduction of the shoulder, and its origin is the supraspinatus fossa, and I'll show the location of the origin site here. And this muscle inserts on the greater tubercle of the humerus, and we'll show that insertion point here. And lastly, the innervation is the suprascapular nerve. Next on our list is the infraspinatus, and its actions include external rotation and abduction of the shoulder. It originates on the infraspinous fossa of the scapula, and we'll show the origin point here. Now keep in mind that the true origin point covers the entire posterior aspect of the scapula, although we're highlighting the medial border. Its insertion is at the greater tubercle of the humerus, and I'll show that insertion point here. And this muscle's innervation is the suprascapular nerve. The next muscle of the rotator cuff that we'll discuss is the Teres Minor. Its actions include external rotation and abduction of the shoulder. It originates on the lateral border of the scapula, and we'll show that origin point here. Its insertion is on the greater tubercle, and we'll show that insertion point here. It's helpful to note too that this muscle lies deep to the infraspinatus muscle that we've just discussed. And the innervation of the Teres Minor is the axillary nerve. The final rotator cuff muscle is the subscapularis, and its action is internal rotation of the shoulder. This muscle originates on the subscapular fossa, and we'll show that origin point here. And one of the things that's important to note also is that the origin covers the entire subscapular fossa, although a single point is being shown here to mark this area. And its insertion is the lesser tubercle. Finally, the innervation of the subscapularis muscle is the subscapular nerve. Now let's transition to reviewing some additional muscles of the upper extremity. Next, we have the deltoid muscle, and its actions include shoulder abduction, shoulder flexion, shoulder extension, and both shoulder internal and external rotation. Now, one thing to note is that we have three sections of the deltoid. We have the anterior, also known as the clavicular portion, the middle, also known as the acromial portion, and the posterior, which is also known as the scapular spinal portion. However, they are all presented here together. So collectively, the origin of the deltoid is the clavicle, acromion, and the spine of the scapula. And the insertion point is the deltoid tuberosity of the humerus. And lastly, the innervation is the axillary nerve. Next, we have the Coracobrachialis, and its actions include shoulder adduction and shoulder flexion. And the insertion of this muscle is the coracoid process, and it inserts on the medial aspect of the humerus. And lastly, its innervation is the musculocutaneous nerve. Next up is the Latissimus Dorsi. Its actions include shoulder adduction, shoulder internal rotation, and shoulder extension. It originates from the spinous processes of the T7 through L5 vertebrae, in addition to ribs 9 through 12. And the insertion of the Latissimus Dorsi is the intertubercular or bicipital groove, and I'll show that insertion point here. And you'll also notice that we're utilizing an open circle here to note that the insertion point is on the anterior portion of the humerus. And last but certainly not least, the innervation of the Latissimus Dorsi is the thoracodorsal nerve. Next up is the Teres Major. Its actions include shoulder adduction and shoulder internal rotation. It originates on the lateral border of the scapula with an insertion on the crest of the lesser tubercle, which is a thin ridge of bone just inferior to the lesser tubercle and medial to the intertubercular or bicipital groove. And you'll notice that we're using an open circle here to showcase that this insertion point is on the anterior portion of the humerus. And lastly, the innervation is the subscapular nerve. Next up, we'll investigate another pairing of muscles, and this pairing is referred to as the obliques. And we have two of these, the external and internal oblique. And as you may know, the internal abdominal oblique is deep to the external abdominal oblique musculature. With that, let's look at the more superficial external abdominal oblique. Its actions permit trunk flexion, lateral flexion, and rotation. And its origin runs from ribs 5 through 12, and we'll show those origin points here. And the insertion of this muscle is at the anterior superior iliac spine, iliac crest, and the pubic crest. And lastly, its innervation is the thoracic nerves. Moving deep to the external abdominal oblique, we'll find the internal abdominal oblique. And its actions include trunk flexion, lateral flexion, and rotation. Its origin is at the iliac crest, which we'll show here, but we have a second origin point known as the Thoracolumbar Fascia, and I'll showcase that second origin point momentarily. But for now, its insertion is on the pubis and on the costal cartilages of ribs 10 through 12, shown here. And its innervation is a combination of multiple thoracic nerves. Now what I'd like to showcase next is the location of the second origin point of this muscle, which is the thoracolumbar fascia. So first, let's talk about the name here. The first part of it being thoracolumbar, that gives us an indication that this structure, specifically the fascia, spans the thoracic and lumbar vertebrae, which it does. And we can see this on the image to the right-hand side of the screen. However, what's unique here is that the beginning point of this fascia is technically the C7 vertebrae. And now that we have an idea about the area that it spans, let's now talk about what we mean by the term fascia. Fascia is simply a term that represents the thin layer of connective tissue that covers nearly every structure within the body. And it just so happens that the external abdominal oblique originates from this structure. The next muscle that we'll turn our attention to is the Rectus Abdominis, and its action is flexion of the trunk. It originates on the pubic crest and pubic symphysis, and we'll show those origin points here. And this muscle inserts on the xiphoid process and on the costal cartilages of ribs 5 through 7. And lastly, the innervation of the Rectus Abdominis is a combination of thoracic nerves. The next pairing of muscles that we'll investigate are the Erector Spinae muscles. And as you may already be thinking, based on the name of this muscle group, these muscles keep the spine erect and or help individuals maintain an appropriate posture. With this group of muscles, we have the lliocostalis, which in and of itself is a group of muscles. And this group is the more lateral of the Erector Spinae. And the Longissimus, which is also a group of muscles on its own, is the more medial of the Erector Spinae. And finally, the Spinalis group of muscles are primarily situated on the spine itself. So first up, let's take a look at the lliocostalis muscle group. Its actions permit cervical extension and cervical lateral flexion. In addition, it produces trunk extension and trunk lateral flexion. Its origin is noted on ribs 3 through 12, the sacrum, and the iliac crest, which we'll showcase here. And its insertion is on the transverse processes of C4 through C6 and on ribs 1 through 10. And lastly, its innervation is noted by a combination of cervical, thoracic, and lumbar nerves. Next is the longissimus muscle group. The actions produced by this muscle include extension, lateral flexion, and rotation of the cervical spine, and in addition to this, it performs lateral flexion of the trunk. This muscle originates at the transverse processes of C4 through C6 and on the spinous processes of L1 through L5 and the sacrum. It originates at the mastoid process, ribs 2 through 12, and the transverse processes of C2 through L5, and it is innervated by a combination of cervical, thoracic, and lumbar nerves. The last muscle or muscle group that we'll look at for the Erector Spinae is the Spinalis. This muscle provides us with an opportunity to perform cervical extension and lateral flexion, along with trunk extension and trunk lateral flexion. This muscle originates at the spinous processes of C7 through T2 and on the spinous processes of T11 through L3. And it inserts on the spinous processes of C2 through C4 and T2 through T8. And lastly, this muscle group is innervated by a combination of cervical and thoracic nerves. Well, thank you for watching this video. I hope it's been helpful, and I look forward to connecting with you again in the next